Good evening, dear ladies and gentlemen, and welcome to the program Face to Face. Today we have a special guest from the Zurich University of Applied Science from Switzerland, Dr. Professor Mr. Meyer, who has come with his colleagues to Mongolia to introduce the concept of the medical treatment for handicapped and physically challenged people, which is called Occupational therapy. Thank you very much for coming to our studio.
Welcome.
And I understand it is your first time to Mongolia.
That's right, yes.
Yes, and tell us about your first impression. What do you think about our country?
Well, I have a lot of sympathy with Mongolia because I think there are also similarity to Switzerland. It's a country in the middle of Asia, in the middle of the continent. Well, we are also in the middle of Europe, of a continent. We don't have access to the sea, and we are surrounded of big countries, as you are. Of course, Switzerland is much smaller than Mongolia, but Europe is also smaller than Asia.
True.
And it's you Mongolians are people loving independence, loving autonomy. So we are also in Switzerland.
Wonderful. So I think this is one of the reasons why you are here. And let's start to talk about the main reason. What is the occupational therapy and how it can be useful in our country?
Well, there are quite a few persons which have some kind of impairment, some kind of handicap. And very often they are not really supported to have meaningful occupation. Often they just don't have anything to do because they lack some abilities. Now the point of occupational therapy is to find out what are the possibilities even of severely handicapped people still to have meaningful occupation and to support them to find it, to make an analysis, to make an assessment of their possibilities, because everybody can do something meaningful. And so we support this, and we in this therapy find ways how it is possible that these people, become productive.
So it sounds like it's beyond than regular general practice of medical treatment.
That's right. That's right. I mean, medicine just, makes people healthy from acute illness. So they won't have to lay in bed anymore, so they can go home. But often some handicap remains, or even there is some handicap from birth. And these are chronic conditions. Now, most of medicine is not there for chronic illness. They sort of make people, overcome acute problems, but then often some chronic conditions stay. And that's where really occupational therapy starts.
So let's go inside of the process, how the occupational therapy works. So let's take a case of a Mongolian girl or boy who has some physical challenge. Let's say they have moving problems. So who should he contact to? How he can be helped?
Well, we try to establish this profession. Now, let's say this would already be established. You have a fantasy maybe in 5-10 years.
Right.
There are quite a few occupational therapists here in your country. So there would be a doctor or some other health professionals saying, well, I think occupational therapy could help this child. So the occupational therapy would have contact, and the first thing they do, they make an assessment. They look very close, what are really the things they can do and what they are not able to do. And after this assessment, they try out together with the child and their parents what could be possible, meaningful occupation, or in the case of children, of course, we try to enable them to go to the normal school, or at any case to learn what children learn at school. And even if they're severely handicapped, to find the means that they can learn what everybody learns. So they will have the basis in the future really to become productive member of society.
And being active. Yes.
And not stay inactive.
Exactly,
right.
exactly.
Right.
So you just mentioned the word fantasy. So now in Mongolia, what is the current situation?
Well, the current situation is that we have a lot of health professionals who know what occupational therapy is and have some similar activities, and they think, well, it would be necessary, but we do not have this profession quite yet in Mongolia. And also the handicapped people and their association heard that this exists. So this was the reason why we are here, because they took up contact with the World Federation of Occupational Therapy. And our director of Institute for Occupational Therapy was at that time vice president of this World Association. So she said, well, we could take over. We sort of try to establish this profession in Mongolia. So she came here first time about 6 years ago, got first contacts, and developed this program, which now as a pilot program already started. We are now at the moment where we want to establish a sustainable collaboration with Mongolia to really build up this an education here in the country, so you can educate your people to become occupational therapists.
So you mentioned about the pilot project you are doing right now. So tell us about this project. Who are the participants from Mongolia side? Who you are training as trainers?
Yes. Well, we're looking for health professionals who already have a grade. So it's about 15 people. Actually, most of them are women. Women, and I think about 2/3 are medical doctors. So they have graduated from medical school, and it's a further education for them. Some are also graduated nurses. So that was the base on which we make this special training.
So what do you train them in specific that they will be delivering to the general?
Well, we train them special method first for assessment. You know, there are quite few techniques how really to look very closely on what handicap they have, but also, and more important still, what are their abilities on which we can build up new activities. So that's the first part. Then, of course, it depends on the kind of problems. We have special assessment and also a treatment for children, for adults, also for old age people. There, the support means that they stay longer independent. You know, they still are able to do their everyday life, to dress, undress, to cook.
Right.
It's also important for old age people.
Oh, that's very interesting.
Yes. And also it's quite common in psychiatry for mental disorder. It's a treatment that the people, in spite of their mental problems, really can do meaningful activities.
So you mentioned about the different age groups we can provide occupational therapy.
Yes.
So please tell whether there are some limitations in terms of sicknesses or disabilities being possessed by the disadvantaged, physically challenged people? Are there any limitations, or it's open and available, accessible for everyone?
Well, I think in acute situation, when you really have to go to hospital and sort of make the treatment for the acute condition, this is not the moment when you make occupational therapy. But once the situation is more or less stable, then I would say there is not really any limitation. Everybody has some abilities. And for everybody who is handicapped, you can find out where the ability is still there. And you can sort of further and based on this ability find out new ways for those people still to have meaningful activities. And this is also, you know, there are also technical aids, like blind people. They can access the internet. They can type. They can understand everything because there are technical devices, you know, sort of reading the thing on the internet and transforming it in words. So combining these technical devices with support is really a lot possible today.
So let me ask you one more question about the people you are training right now. You mentioned about the highly educated doctors and also nurses.
Yes.
Does it mean that we can also involve in occupational therapy service provision people of non-medical background?
Yes, I think quite a good basic education, a graduation from high school is necessary because it involves also to read international literature, you know, scientific journals, because all these things keep on changing. And also back at Switzerland, we learn them how to learn what is coming new, because the knowledge changes. There will always be innovation. And to get a good training means that people, when the training is finished, will be able to pick up innovation. So they really, you know, have to know a lot of language and also some natural science. Yes, to, you know, to stay in contact with the most recent innovation.
Right. So one thing we might need to consider when you talk about this new service available for the physically challenged people, that in Mongolia mainly people criticize the current system, that majority of professionals, they are trained in Ulaanbaatar city and they tend to stay in the capital city. And these kind of new innovative services are not available or accessible for people in the countryside where there are no doubt there are so many people in need. How do you see how we can involve those people in need in the countryside in accessing this kind of services?
Basically, it is really possible to provide occupational therapy on countryside because you don't need, you know, big computers or big big equipment. It was really possible, you know, to bring some equipment to the villages and work with this. But the condition, of course, is to train the people. So we have the idea now, train the trainers, and the trainers train people to learn it. And if the number of people which have a grade, we have graduated from this program, then they should also be, you know, dispersed in the country, not only staying here.
Exactly.
I agree with you.
And you come from Switzerland.
Yes.
Do you have the system of providing operational therapy services in the countryside? Although your country is
well,
quite small.
Our advantage, of course, is that, I mean, from one corner of Switzerland to the other corner, you can take a train and it doesn't take more than 4 hours. But still, for handicapped people, this is not a good thing. So we have quite a system where also local little towns or big villages have some services which are not connected to big hospital. There can even be outpatient services where people come with handicapped people, come on the wheelchair and go there and are supported, and they don't have to come to the big cities.
I see. So everything is possible.
Almost everything.
So
well, if there is the will, you know, if the concept of this helping handicapped people to become productive member of the society, which is good for them and is good for society. If the Ministry of Health and if the Health University and if the people see that this is necessary, everything is possible.
Exactly. So tell us about the necessary conditions important to ensure that this project stays in Mongolia once you leave.
Well, very necessary is that we have a good collaboration with a center which can take over a program. And I think we have it. We had a talk with the Dean of the School of Nursing of the Health Science University of Mongolia. And he is interested in that. And he already had a program for physics